Hello, everyone. Welcome to the All Things Good podcast. I'm your coach and your host, Giovanna Cirillo. Thank you for tuning in to the podcast that helps you with self-development, mental health, and your overall wellness, helping you become the greatest version of yourself. I hope you are doing well. I want to make some quick reminders before we get into today's podcast and episode. As a reminder, if you're looking to become a guest on the podcast, hit the link tree. There is a form. You can schedule a call with me and we can go over your topic, your episode, your story, and see if it fits with the vision of All Things Good. On another note, I have a new series titled The Homecoming. This is for my ladies. This is for those who are looking to come back home, back to themselves, who have lost themselves in people pleasing, who have been hindered by trauma, who have been hindered by shame, or just looking to come back to themselves. If this sounds like it resonates with you, hit the link tree once again. The Homecoming series is there. You can follow. In this particular series, I will be sharing my tools. I will be sharing my personal story and how I came to this person and this version that I am today, which honestly, I love. So if you are looking to get back to loving yourself and becoming the greatest version of yourself, that is the series you want to tune into. On another note, if you are not following Bereavement is a nonprofit organization located in New Jersey that is geared towards helping men heal from grieving. To me, I'm not going to stop saying this. It's an amazing vision, an amazing story. If you are not following them on Instagram or Facebook, Bereavement, there's always something that they are getting the men involved with when it comes to healing and process their emotions. To me, it is beautiful to see. Follow them. Today we have James Keppel, who is the founder and CEO of Sarana Health. He is a creator, a builder, and the maker of things, and the lover of vinyl. He has been a leader in strategic development. His role in the universe is to help shape how people experience and react. He is a business planner and a thinker. He believes that the value of any idea is virtually zero without impeccable execution. Help me by welcoming James Keppel. Welcome, James. How are you today?
Good, Giovanna. Thank you for having me.
Thank you for being a guest. I'm so excited to hear your story and more about Sarana Health. So Sarana Health, I am pronouncing it correctly, correct?
That's right.
Okay. Yep. Sarana Health was birthed from a health condition that you experienced. Can you tell us more about your history and what led Sarana Health to becoming?
Let's see. I had been running a design firm for a number of years, and I decided to sell the company, and I was just kind of at this transition point of not quite knowing what to do next, and had some ideas, but hadn't really settled on anything. And I suddenly had this health problem where I needed a liver transplant, basically. And based on some previous research into the area of integrated health, I decided to just kind of treat myself because the legacy healthcare system really wasn't doing what I thought needed to be done. And just to be clear, I'm not a doctor. I'm in the healthcare business, okay? But I hopefully was smart enough to understand what the doctors should have been doing. And they really weren't able to do it because of the way that the legacy healthcare system kind of works. It's not as care-based as I would like it to be, I guess is the way to put it. So through that, I realized there was a business to be had and that we could make an effect. And, just to be clear, I don't anticipate we're ever going to be $1 billion business or anything like that. Although if that happened, that would be great. But our mission is really to just kind of make a dent and say that there's another way to do this. And I experienced it personally. The outcomes for me were pretty miraculous, basically. I went from needing a liver transplant to 4 years later, not needing a transplant. My liver function went up by about 40%, which was remarkable. And so I knew it worked, basically. And I just saw the opportunity and was able to kind of formulate the way that I thought it should be and bring it out into the world.
That's awesome. That's amazing that you took matters into your own hands and you said, you know what? This is not going to happen. I'm going
Well,
to change this around.
that's kind of one of my things about the legacy healthcare system is that they require you to manage your own health, which I just don't think is the right way. That's the way it should be. When I ran my design firm, I didn't look to my clients to tell me what to design. I told them what they needed to have designed. So, just seeing that they were not advocating necessarily for me as much as I wanted them to be, and I had to advocate for myself, that really was kind of maddening. By nature, I'm the kind of person who just wants to fix everything. So, like, send me into any restaurant and I can tell you what they're doing wrong, or at least what I think they're doing wrong. And I'll give you, just a recent example. Within the past couple of days, I'm traveling right now, and I needed to get a prescription filled because I didn't bring enough of what I had, what I needed with me, and I spent 3 hours trying to convince people to give me a prescription. I finally got somebody to do it, and it was dozens of calls to doctors and everything just to fill in a prescription that I've had for 5 years at this point. And in the end, they wouldn't even take my insurance. I had to pay out of pocket for it.
Wow.
So it's just a broken system overall, and I think it needs to be fixed. That's all I can say.
I agree. And I think a lot of people can agree with that statement that it is broken and it's primarily for capital, for personal gain, and it's not necessarily for the people. I've seen a lot of stories, a lot of people who've experienced the same type of treatment when it comes to healthcare where, it's not benefiting them. They're not actually listening to what they're going through, and what they're prescribing is not necessarily beneficial for them. And they're over it. So I love the fact that you created Sarana Health as a solution for people to take, a different route and take matters into their own hands.
Yeah, not to, this doesn't come from ego, but I generally consider myself to be a smart enough guy that I can sort of manage a system or manage something that's not going right. But there are a lot of people out there who just can't. And
Right.
the doctor says, do this, they just do it and keep their fingers crossed. And I just don't think that's right.
Right. And I think we should all come to that place. I like that you said that because start questioning things. Like we're not meant to just be blind sheep, just listening and just following every command. We're meant to question systems and create our own, which benefits us and may benefit other people. So tell us more about Sarana Health. How is it different from the traditional healthcare system or different programs that are out there?
It's one of my favorite questions because I say kind of, cavalierly, I guess, anything about the legacy healthcare system, we do it to the opposite. Okay. So I'll give you one example. The insurance industry in healthcare has decided that for some reason, a doctor should spend 10.6 minutes in a room with you. Okay. 10.6 minutes. Hi, how are you? What hurts? Here's your prescription. Come back and see me in 6 months. Okay, what we do, completely the opposite. We have to understand who you are, and our key differentiator is the one-on-one care. It's kind of like going back to when I was a kid. You went to the doctor and you talked to the doctor for an hour, you know,
Mm-hmm.
or a half an hour, whatever it was. But whereas you get this 10.6 valuable minutes where the doctor rushes off, they've probably, in a lot of cases, they've done no prep to even understand who they're walking in the room with. They probably don't remember you from 6 months ago if you were there 6 months ago. And they're off to the next thing because they've got to see 20, 30, 40 patients a day. Um, Again, we do it completely the opposite. Our intake is 90 minutes with 3 healthcare professionals. You've got your physician, you've got a health coach, and you got a nutrition coach. And these are all highly, like, at the top of the levels of certifications and training. So for
Awesome.
example, our nutrition coaches are not dietitians, they're not nutritionists, they're CNSs, which is a certified nutrition specialist, which is a science-based approach to nutrition.
Okay.
So you're in there for 90 minutes. They get to know you, you get to know them. I half jokingly tell my health coaches, you need to be our client's best friend. you got to be the first person that they call when there's a problem, right? Not the last person because they don't want to deal with you because it's going to be the runaround kind of thing.
Mm-hmm.
So just having that dedicated 90 minutes of really getting to know who you are, getting to know your sleep habits, getting to know your nutrition habits, your general approach to your lifestyle. I mean, all these things, that's an incredibly important part. And if I had to point to one thing that's different about us, that really is it. And throughout the program, you're always dealing with the same people. It's not like telehealth where you get whoever happens to pick up the phone. You know your health coach, they know you. And when they get on the phone or the video conference with you, it's a matter of, okay, here's what we talked about last time. How's it going? Okay, here's what we need to
Right.
adjust, and here's what we're going to do moving forward. So it's a constantly iterative process. It's not a one and done kind of thing.
I love that because for me personally, like I personally dislike having to repeat symptoms and situations. It's like I just spoke to the person previous to you. Why aren't you guys communicating with each other on my specific condition or my situation? So that can be frustrating. So I love the fact that you're dealing with the same people and you're getting to know each other, the history, and there's that relationship, like you stated, that is being created and formed so that there's a form of trust. And like this person, like they can have that safety and that knowledge to know that they're for me. Like they really want to know how to better my situation or my health condition.
Exactly. And a lot of it comes to prep before your appointment and what happens after. So whereas in the legacy healthcare system, traditionally, you get the doctor walks in, they have probably looked at your chart while they're walking in the door, and then they walk out and then they pass it off to a PA or whatever. Not to say that those people aren't qualified, but it's just, it's a pass off. And a pass
Right.
off means something is going to get left. Okay, what we do is we have a half an hour where the entire team meets before they talk to you. They spend the 90 minutes on the intake with you, and then they spend a half an hour together following up. So we're looking at treating 4 or 5 patients a day, not 40.
Right. Right. And for my listeners who are listening, and this is something that you want to, look into, I advise you to have some patience. 90 minutes sounds like a long time, but this is 90 minutes of getting to know you so that they can better help you and understand your condition, your blood type, all these things. I mean, I'm sure there's so many things, so many factors when it comes to Sarana Health and how you guys implement your healing process. What changes or stories have you experienced or witnessed through your particular program?
Well, I'm a patient of us, but so number one, I can relate my story, and then I'll give you a couple others. With me, because of my liver condition, even though I'm out of the woods on the transplant, I still occasionally get these what was blamed on ammonia spikes, and I get, kind of just not able to really be there, and sometimes don't make a lot of sense, but
Right.
and not remembering things and everything. And typically I'd go to the hospital and I'd meet with a neurologist, and I had one neurologist tell me that it was a psychiatric problem. And I said, well, wait a minute, this happens every day an hour and a half after I get up. So how is psychiatric problems don't work on a schedule? And
Wow.
they just sent me on my way, and they got me a next level of testing, and I never saw that person again. So what I did was I went to our team and I said, okay, here are the problems. And what we did is we looked at it from 3 different directions, as opposed to a neurologist looks at your brain, a GI specialist looks at it from their perspective. So we looked at it as the overall thing, and we came up with what sounds like a completely ridiculous way to head it off. We haven't solved why it happens yet, but the way to head it off is I take 2 doses, a double dose of the medication that I normally take in the morning, and I drink Gatorade, and that's it.
Mm.
And just the electrolyte balance and everything changes. And I can tell you it works every time.
Wow.
But that was because we looked at it from 3 different directions. We looked at it from a nutritional standpoint. We looked at it from a GI perspective. We looked at it from a neurological perspective. And
Right.
bring all those things together, that was where we got to a solution. And the next step is to make it so it never happens again. But, you know,
Right.
working
Right.
on that. So that's my personal experience. I'll give you a couple of other quick ones. We have one client with us right now, back pain for 20 years. And he comes to us and we get him in the program. And he said he met with us twice. We changed his nutrition and some behavioral and lifestyle things, minor tweaks. And he said he immediately felt better, like he never has
Wow.
in 20 years. And that's not hyperbole. This is a real thing. We've got another client right now who's premenopausal and
Hmm.
met with us a couple of times. We changed her diet and we made some very, very minor tweaks around things. And you know, it wasn't a wholesale change to her diet. It was just understanding what her diet was and then adjusting it. And she has immediately seen results. So, you know, you can look at it from any condition, really. If you approach it, as I say, we're detectives. You know,
Right.
we're looking for the things that are causing the problems, not the way to mask the problems. And that has made all the difference in the world for myself and other people.
Right. I love that. The investigation part, because sometimes uh, the doctors, I mean, they can be so quick to just, this is it. Like a quick diagnosis, or yeah, just take some Advils or take this prescription. It's like you're not investigating my history. You're not investigating, like you said, the different factors of it. And everything is connected. Like, did we forget that? Did our doctors forget that everything is connected, whether it comes to nutrition, your mental health, all these things seem to have a factor in how our body responds. And so I love the fact that you guys take the time to investigate and really try different things and see what works for your clients or your clients.
Yeah. And it is an iterative process, and that's what everybody has to understand. It's not take this pill and you will be better.
Right.
You get in the program and you know you meet with your health coach and your nutrition coach every month, and there's regular check-ins, and you're always changing something because okay, well I did that, but now this is happening. And then we go to our proprietary testing panels and we look and we say, okay, that level was supposed to be at this, but now it's at this. So
Right.
we're gonna one way is to say, okay, so say something silly like protein. Okay, your protein level's too low. Okay, the natural solution would be to give you more protein, right? Okay,
Mm-hmm.
and you take powder and you eat more meat or whatever, or legumes, and you get more protein. That's one way to solve it, maybe. But another way to solve it is to say, why is your body not producing enough protein?
Mm-hmm.
And that can be, you could be 10 systems removed. Like I happen to be familiar with my liver. Your liver is involved with 500 body functions.
Wow.
And you're trying to find the one needle in the haystack, but if you're not committed to finding the one, you will never find the one.
Right. Wow. Wow. That's amazing. That's amazing. And I love the work that you're doing. I love it. And I am truly just amazed by the progress that you guys are making with people. I love that. So, for me, mindset is everything. How important is mindset when it comes to wellness and when it comes to helping the clients that you have encountered so far?
Well, you've hit on a great topic in that, you know, wellness in general is about a complete approach. It's not just do this, do that, do that. It's you have to look at the whole thing.
Right.
And mindset is a major part of that. And, you know, there's a lot of push, especially on the health tech side and mental health. And
Hmm.
in my opinion, nobody's really cracked that nut yet, but they're making progress. That's great. But your mindset, like anything else, if you don't want it, it's not going to happen. Okay. So we get clients, and one of the interviews, questions that I use when I talk to coaches, I say, well, what do you do with a person who just won't comply? Right.
Hmm.
Okay. So it always comes down to little things. If you go to somebody and say, okay, your lifestyle sucks, your nutrition has to go out the window, and all of a sudden it's like, wait a minute, you just changed my entire life. That's not the
Right.
point. You have to take incremental steps. And the mindset toward, okay, so say you have a sleep issue. Okay. And it's tied to your mindset about I can't sleep or whatever, or whatever.
Mm-hmm.
So if you start breaking down what the roadblocks are to getting to the best possible mindset, then you get there a lot more effectively. Maybe in some cases, not faster necessarily, but you get there because you're making the incremental changes. So
Right.
wholesale change will freak everybody out.
Mm-hmm.
um, some people like myself, you tell me to change everything, that's fine, I'll do it. But most people don't do that.
Right.
So you have to look at what are the small things. So again, to go to nutrition, which really is the foundation of all this, I think. Um, uh, if you get someone who's of Indian descent and you say, okay, well, your problem is you're eating too much rice, don't eat any more rice. You're not going to get anywhere with that. So what you do is maybe you say, okay, reduce your rice intake by 10%. And
Right.
now we're going to have you eat this to balance the fact that you're basically eating too much rice or whatever, you know. Uh,
Mm-hmm.
so so instead of trying to change people's lifestyle, we try to adjust the treat or their approach, I should say. Instead of trying to change their approach, we try to manage their approach, I guess is a better way to put it, and to introduce some things that maybe they're not doing, or maybe they're not doing enough of, or maybe they shouldn't be doing, and try and break down those little component pieces. That's the
Right.
effective route.
Right. Right. Okay. Yeah, I like that. I believe that mindset is everything when it comes to wellness. Like you stated, it really begins there. Like you have to want to be healthy. You have to want to get better. And some people just, they take their condition and they say, okay, this is it. But like for you, you had the mindset like this is not it. Like this is not my life. I'm going to change this. And how can like what encouragement? I know you're not a mental health coach, but what can people do to kind of begin to change their mindset? Do you have any like what did you do personally to begin to? I know you already had that grit within you, but for other people that you encounter or experience who may not have that same grit, do you ever like encourage them in some type of way to help them change their mindsets?
Every coach has a different approach to
Right.
this, and that's why we spend a lot of time pairing up the right coach with the right people, and that sort of thing. And like I said, they got to be best friends.
Right.
So I think I can't answer that in a really blanket kind of way, other than to
Mm-hmm.
say it's again a very personalized approach. Everything about your wellness and your health is about who you are. I could give you a podcast on why acceptable ranges that you see in lab testing, it's nonsense. Okay.
Right.
Because it's not about you. Just because, again, use protein or let's say insulin level. Okay. If your insulin level is one thing and mine is another, and then you get somebody who says an acceptable thing is this, how do they know that it applies to me and you? We're
Right.
completely different people. It's like, are you dealing with a Dodge or a Chevy? I mean, they're
Right.
completely different systems, and you have
That
to
makes sense.
tune that to that person.
That makes sense. That makes a lot of sense. Thank you for answering that in that way. So okay, so as a wellness coach, what are some practices our listeners can begin to implement in their day-to-day lives?
Um, well, number one, sign up for Sarana Health. But boy, that's a tough one. So we base our program on four foundational elements: optimal wellness, sleep, nutrition, and lifestyle. And I think that the success from a coaching standpoint is understanding how to balance all those four things. So our
Mhm.
CMO, for example, is a neurologist by training. He happens to understand integrated health at a level that a lot of people don't. But you know, his sleep is his specialty. So if he's the right person to be dealing with the sleep issues with the health coaches and that sort of thing, then that's great. So that might be one approach for that person. Um, Nutrition, as I said, is the foundation of everything. And unfortunately, the food source that we have in the United States is generally garbage. Um,
Right.
try it. I'm the jackass at the grocery stores reading the labels. Um, and the reason is because, if you don't know that 2,500 milligrams of sodium a day is a bad idea, then maybe you need to rethink that can of cheese
Right.
that you're going to buy, right? So, yeah, I might be straying a little bit away from your question here, but when you look at those component parts, those four foundations, we found that the combination of looking at all of those and how they work together, um, in a lot of cases, is a solution. Sometimes the solution is just one of those foundations. Like if somebody's got
Mm,
a real problem with their their behaviors and lifestyle, then maybe that's the root of the problem. It all comes down to this individualized care, understanding who the people are, and really working with them within their parameters, not trying to be dogmatic about things, not being prescriptive. It's like, if you
mhm.
don't do this, you're never going to get better. What's the point?
Right, right. So you said there were four pillars. Can you
Yep.
mention those again?
Optimal wellness, sleep, nutrition, and lifestyle.
Okay. I don't think people understand the power of sleep. I think that one may be often overlooked.
Oh, it's tremendously overlooked, and I'll be the first one to tell you that my sleep is not where it needs to be. I'm working on it and getting better, but it's really hard because, the day-to-day world just doesn't support that. Everybody laughs,
Right.
like, you go to Europe and they take 2 hours in the afternoon for lunch while they go to sleep. You know, there was a NASA study a while back that said if you take a nap for 27 minutes, that you can recharge yourself. So I try and take a 27-minute nap every day, and I'm not always able to do it, but I wish I could do
Right.
more. But you would be amazed at how that 27 minutes will recharge you. So that's just one thing that works for me. It doesn't mean it worked for everybody else,
Right.
but that's one thing that I've locked onto, and that those are the types of things that our coaches talk about. It's like, well, here's a thing. Do you want to try that? No, I can't possibly make 27 minutes out of the day. Okay, here's another way to do it. Uh,
Right.
and this concept of getting 8 hours of sleep. I mean, anybody in the world now who gets or in the US right now who gets 8 hours of sleep is a pretty rare person.
Yeah, I mean, just recently, I say that because just recently I could not sleep for about 4 days straight. I was waking up every night at 1 o'clock in the morning till 4 o'clock in the morning. I was up. And on the fourth day, I was like, oh my God, if I don't get any sleep, my mind was everywhere. My emotions were unstable. I felt sick. I felt nauseous. When I began to look this up, I'm like, I didn't realize that sleep was so important when it comes to your health. So
Yeah,
that's
and
why I
luckily,
brought that up.
it's getting to the top of the consciousness out there now that it is as important as it is. But it really, that's one area where you got to make some lifestyle changes, and you really got to be committed to doing it.
Right.
Um, to me, that 27-minute nap is more important than lunch. You know, I can eat lunch while I'm working. I can't sleep while I'm working. Well,
Right.
many people would accuse me of sleeping while I'm working. But so yeah, you just everything about this whole concept of integrated health is finding what works for you.
Mhm.
And the legacy healthcare system does not generally, I'm generalizing here because not everybody's like this, but a lot of them are just a lot of people within the system are just in that. Here's the number of people I need to see every day. This is draining. There's no time to do my paperwork. All these
Right.
things. And what we try and do operationally is reduce that load so that the care providers can be doing what they do best and what they should be doing. So we've made the to see your patient records. We've focused on how to make that take as little time as possible, and that's Obviously, it affects profitability in a business, but that's not really the point. The point
Right.
is I didn't hire a CNS to be really good at record keeping or, giving me a monthly report or something like that. I hired them because of the quality of the care that they can give.
Right, right. I love that, James. I love this interview. How can we learn more about your business? Do you have any openings? Do you have any free consultations? What do you have going on right now so that our listeners can begin to, follow you or begin to book a session?
Well, we start off with a free 30-minute discovery call, and that's with a health coach. And again, we occasionally test the quote unquote competition, although I don't think that we have anybody who directly does what we do. We'll kind of check and see what they do. And I cannot tell you how many of those free calls are marketing calls.
Mm.
I tell our health coaches that is not what we're doing. What we're doing is something that I've done throughout my career. When I had my design business, I never went in for an interview for a project. I went in and I served in the project. And, and I very rarely lost any work because of that. So I tell our health coaches, when you get them on that call for the 30 minutes, you're treating them. And that is one reason why we ask for a HIPAA release and everything before you do that 30-minute call, because we want to be able to allow you to talk freely and know that's the opening. So in answer to your question, we offer that 30-minute free call, and I encourage everybody to sign up for that. And you can go to Sarana.health is our website, and you can sign up for that free call. And that starts you rolling in the program. If you want to learn more, the website's a good place, Sarana.health again. You can always contact me directly. I'm easy to find on LinkedIn. My direct email is james@sarana.health. So we're not hiding from anybody. Let's put it that way. But I really encourage everybody, just try the 30-minute free call. It's 30 minutes out of your life. You'll see, I hope that you will see the benefit right out of the gate.
Right. And just with this episode alone, just sharing how you guys integrate everything, I think will be very beneficial for our listeners to understand that you can be trusted. Like I feel comfortable. I feel safe. If I was to do a session, I would feel comfortable knowing that you guys are integrating all factors of my life and actually taking time to get to know me. So I think that's amazing. Thank you so much, James. I have learned so much from this episode. Are there any last words that you want to share today?
I just want to say thank you. It's 80% of what we do is education, and there are two components to that. We need to educate people about their care, obviously, but also we need to educate people about the fact that there is another way to get health care. Okay.
Right.
You don't have to go and do the normal thing. There are other ways, and I'm not talking about yoga and that sort of thing, although that's great, do it. And we often recommend stuff like that. But so with that 80% of education, these opportunities to talk to you are great, because what we're trying to do is help people at the bottom at the end of the day. And by hopefully opening some eyes to the fact that there are other ways and that it's easy to get into, it might seem like it's this additional cost, but I always say, can't afford to be healthy, how can you afford to be sick, right?
Right.
So yeah, it costs money. We're a business, but we have not had a single client yet who's asked for their money back or said that they didn't feel they got value. So thank you for the opportunity, and we're helping to spread the word for us.
Thank you, James. I hope you have a good day.
Great. Thank you.
Thank you. I'll talk to you soon.
All right. Bye.
Bye.